Hi, it's Cathy here with Tri-Cities Community TV in the beautiful Lee Square in downtown Port Coquitlam. Today we will be talking to Mayor Greg Moore about the Hawthorne Seniors Care Community. Thank you so much for being here with us today. You're the chair of the Capital Plan Project. So I feel like you're wearing a couple of hats. Tell us a little bit about why you're the chair, and it's a little different from your day-to-day work. So explain that to us a little bit more, Mayor Moore.
Sure. Well, thanks for having me, first of all. Hawthorne Community Care Facility a few years ago realized that they needed to do an expansion and upgrade part of the facility. They started down the project last year, and then they needed to do a capital fundraising campaign. So they came and knocked on my door and said, "Would you mind being a part of this?" And I said to them, and they knew, my mom lives at Hawthorne. And so my mom has very advanced dementia. She's been there for about 14 months now. And just the family of caregivers that are at Hawthorne, it's the least that I could do was to head up this capital campaign so that they can upgrade the facility into today's standards.
And so how many rooms do they have now?
So they have 3 different care facilities. It's kind of like a campus of care where they have some longer term, and that's the area that we're looking at. They have cottages where it's early stage dementia and some very really cool kind of ways for people with dementia to still live together in a family environment. And then they have some assisted living, which is very low barrier type help. So we're talking about the longer term care facility, people that really need 24/7 care all of the time, all of the year. Some of them need help eating, some have dementia, some have other issues. And right now it's very much a hospital type setting. You know, it's not sort of what you would want your family necessarily to live in.
Right, so it's very different from our retirement independent living type of communities then. This is more medical care, would you say? There's nurses on hand helping do we call them residents, patients? What would you call them?
We call them residents because it's more of a family environment, right? You know, and it is a family environment as much as, so this part of the facility hasn't been upgraded for decades. So it still has, a very much that institutional hospital type feeling to it. And so what we're doing is we're doing a $4.2 million expansion.
Wow.
So what that really means is everybody, right now there's quite a few people that have double bedrooms. So my mom has someone lives in a room, roommate. So, which is, you know, my mom probably doesn't know too much of the difference at this point in her life, but where it really affects is the family. So, you know, my dad's there every afternoon. He's there having dinner, helping mom have dinner every day. But they can't go to her room afterwards and hang out and watch TV or something like that. So it kind of doesn't have that family feel to it. So this expansion will have 19 new rooms. So every resident there will have their own room now.
Great.
Instead of having a big cafeteria area, there'll be 3 cafe areas.
Okay.
So now it'll be a little bit more of an intimate dining experience.
Right.
For the residents and the residents' family. There'll be fireside areas, there'll be new nursing stations. There'll also be new bathing stations. So, you know, my mom can't bath herself anymore. She needs help. And right now there's shared facilities. And so this will just offer some more dignity to the people that are living there. So it's really about getting up to today's standards and having that sort of warm, caring family feel that we would want for our loved ones. We want them at home. And so why wouldn't we want that for our parents when they're living in a facility like this?
An extension of your own home, really.
Absolutely, because as family, you're there all of the time.
Yes, and you have privacy.
Privacy, you want intimacy with your family. You don't want to be, you know, if I go to hang out with my mom now, we're hanging out in a hallway or we're hanging out in the big cafeteria area, which, you know, it's okay, but it's not maybe where it should be.
So obviously there was a need in the community. What did Hawthorne do to essentially find out about that need? Our population is getting older, as we know, and so I guess I just want to know, can you walk me through the process of them sort of going out to the community and seeing, or was this just, it was just time for this sort of area to be, you know, expanded upon?
Yeah, I think a few things came together. I think there was always this Hawthorne, first of all, let me back up. Hawthorne is run by the Port Coquitlam Senior Citizens Housing Society.
Okay.
So Hawthorne isn't a government building.
Right.
It's owned by a Port Coquitlam nonprofit that owns Hawthorne Community and runs Hawthorne Care Facility, but also has some other seniors' homes in our community.
Right.
So it's not a government, why doesn't government just do this? And so that was the first thing, is they looked at what the type of service was that was being delivered right now, looked at the what they would love to be able to deliver, what they do in their other parts of their facility, but then also the current standards that Fraser Health has, because Fraser Health is a majority funder of the operations at Hawthorne.
Okay.
And so when you looked at all of those things, the board decided, you know what, we need to get on with this. This is the first time that Hawthorne has actually ever gone out to the community to do capital fundraising. And they've been in our community for over 50 years. So it's kind of a big deal for Hawthorne to actually go out to the community and say, we need your help to help fundraise for this facility for our parents, our elderly, people that, you know, everybody in Poco has some sort of connection to Hawthorne.
Right.
Whether you have a parent there, or I think every elementary school kid from, you know, the beginning of time
Right.
has gone there to sing Christmas
Right.
choir or seen them at the parade, that sort of thing. So there's this real great connection with Hawthorne. So now Hawthorne is actually going out to the community and say, we now need your help.
So as the chair, how do you plan on raising the funds, and who are you going to go to first?
So it's a $4.2 million expansion. The first place that Hawthorne did is they said, okay, we can manage a $3.2 million mortgage. And so through the help of BC Housing
Yes.
and through Fraser Health, they'll have a $3.2 million mortgage. So we need to, our capital fundraising campaign is $1 million we're trying to raise. The first place that we went was within. We said, okay, you know, let's look to our board and our staff, because we have over 230 people that work at Hawthorne.
Okay.
And so we went to the board and we went to the staff where, you know, giving starts here. And we had over $130,000 either gived or pledged from our board and our staff. So we thought that was phenomenal. So that was the first time we'd ever asked our staff
Wow.
to also step up, which was great. And then, so for the last 9 months, we've been in a quiet phase, which you do with most capital fundraising, you do in a quiet phase. So we've gone after and worked and partnered with community businesses, developers, other community entities. We've had one nonprofit contribute as well. We've gone after grants. And so, you know, we're on March 30th, we're launching the public part of our campaign, where we're going to be really pleased to announce that we've raised $568,000 of our $1 million goal.
Right.
So now we're going out into this public phase of the campaign, where we'll see maybe not the big checks coming in, but we'll see a lot of smaller checks by businesses that can maybe afford $1,000 over 5 years.
Right.
Or a family that has a family member there can do $1,000 over 5 years.
Exactly, exactly. So besides the March 30th launch to the public, do you have events that are coming up that maybe you'd like our viewers to know about?
So I think the best thing that our viewers can, or our viewers can look at is we have our March 30th as our big event, but we don't have any other events after that planned, because we're really looking to engage the community in conversation. So if someone wants to go to our website at hawthornecares.com, they can go there and get that information. There's a link there to our capital fundraising. If they want us to come out and have a conversation with them, their business, maybe their neighborhood, you know, some people have close-knit neighborhoods and that sort of thing. We'll come out and we'll have a conversation about what we're doing. If people want to have a tour of the facility, they're thinking about giving and they really want to see what's there now and what we're visioning into the future, they can just contact us and we'd be glad to give them that tour.
Well, that sounds fantastic. Hawthornecare.com, is that correct?
I think that's
fantastic. Right. We've been listening to Mayor Greg Moore, the chair of the capital project for Hawthorne Seniors Community Care, and they're looking to raise $4.2 million. They're halfway there, and they're looking for another $500,000. Reach out to them if you'd like to donate, if you'd like to view the facility at hawthornecare.com. I'm Cathy Chenna reporting for Tri-Cities Community TV.